Oh, all right. Third time's the charm. Looks like we finally got this close-up going. Let's get right to it here. That took a lot of effort to get that to work. A lot of tries anyway. Good morning, everybody. I am here with Brooke, as you know, and we had a little bit of a pre-show on the regular Kitten Academy live stream. I've been in here for a few minutes already. So I'm going to try to take her blood and get a glucose reading while we're here. So that's what I'm going to be doing while I'm talking to you, is getting that ready. Now, keep in mind, this is only the second time I've ever done this. I did it once to make sure that I could do it, and that's the only time I've done it. So we're going to give it a shot. Um, During the pre-show that we just had, I was trying to get her to eat a different kind of treat than the Temptations. And you see we got the Temptations out again today because the other kind of treat that I had found in the few minutes that I had was a dried lobster and fish treat that she did not like. So we got that in common. But when I was at the vet yesterday, one of the things that the vet brought up, there were a few things that we talked about Brooke, and Brooke wasn't there, but we talked about her. So one of the things was that the vet, Dr. Katz, who is just a wonderful human being, Dr. Katz is, Dr. Katz said that she had watched the stream where I had been in here, doing this thing every morning with Brooke, and she saw that I was giving her a whole bunch of treats, and she was like, "Oh, don't do it." She thinks it's just too many like carb-loaded treats for her. And she said, that's not a bad idea overall, but if you have to do it, why don't we go for something that's just all protein, like freeze dried. Her cat at the vet likes those freeze dried uh, little fish, not minnows. They're the kind you put on pizza. Why can't I think of this word? Sardine? No, not sardine. That's not right either. What is the fish that I'm not thinking of that? Anyway, it doesn't matter. Anchovies, thank you. Anchovies, yes. Okay, that was Lady. I can't read this from here. Lady Hawk. Good. Yeah, great classic movie too. Yes. So anyway, she suggested that because that's what she gives to her cat. It's all it's excellent little thing for cats. So I ordered some of those. I don't have any of those. I also ordered bonito, which you guys might be familiar with, which is basically like dried tuna flakes. I thought that would be a good choice, but those are both on order. I thought I had freeze-dried chicken around here somewhere, and I'm sure I do. I just couldn't find it in time for this morning's stream. So I did find the freeze-dried lobster and fish treats, though, but she didn't like them. So, I mean, by that, Brooke, of course, didn't like them. I'm sure the vet would have been fine with them. So that didn't work out. Um, but that's okay. That's all right. I figure one more day of the Temptations isn't going to hurt, or even a few more days of the Temptations isn't going to hurt. And then, speaking of things that Dr. Katz thought about what we're doing with Brooke every day, I told her I bought the Alpha Track glucose monitor for Brooke, and this will go to whoever her doctor is in the end, too, so they don't have to worry about the expense of that. Not that it was very expensive. And I bought a whole bunch of extra test strips and all the accessories that go with it, so I'm hoping that she gets adopted, well before we run out of those, and the adopter can take all that stuff. When I told the vet that, we had a little discussion about her blood sugar levels and monitoring them, and the vet thinks that it's a good idea if I test her every morning before we give her insulin so we can see how she does. So that is exactly what we're going to do. And that's a long way of saying we're going to do that, I guess, right now, see if I can get it figured out or not. And again, I want you to keep in mind, we don't have a technique down for this yet like we do for giving the insulin because, again, it's only the second time I've ever done it. And I know so many of you that are watching are going to be yelling at me in your heads going, "Oh my gosh, well, he's doing this all wrong." We'll get it sorted out though, all right? I promise. We'll eventually get it sorted out. Now the directions on the machine say to put the strip in and then put the blood after you've got the strip in the machine. But that's backwards from how I've seen the vet do it. The vet takes the strip and puts the strip in the little drop of blood and then puts it in her machine. And that seems like that would be easier, but for now I'm going with the directions that are on the machine. It says to put it in first, which is what we've done. I'm also going to get a couple treats at the ready so that we can make sure that this little kitten is distracted, but I got to flip her around so that I have access to her and to her ear. Also, using this, there's a lancing device. It's spring-loaded. The vet never uses it. I think the reason that she doesn't use it is because it makes a noise that can scare cats, and that makes perfect sense to me. I completely understand. It was my first thought, too, is I shouldn't use it. But I'm still a little nervous about doing it without, so I'm going to use it again today since I did last time. Now, she doesn't want me to get in her ear very much, but I'm going to do it. Come on now. Come on now. We're good friends. Just get a little right here. There we go. Good. I think that did something. Maybe it didn't. It's another problem with using this thing is that it doesn't seem like it actually works all that well. It's even at the biggest setting for the most pokiness, the highest pokey setting. Sounds like something from Pokemon. Let's try it again. Well, I might have to do it by hand because I can see this is not really doing much for me. Now I know, oh, now there's blood here, but where's it coming from? Did I poke right through her ear and the blood is coming out the backside? Crying out loud. It is. That's exactly what's happening. Okay, let's use that still. Wow, she's very calm about all this though, isn't she? Okay, now we got the blood on the device, so we did that. I'm sorry, sweetie. I should give you bonus treats for that. Wow. Well, if this is a good reading, and I have no reason to think it's not, we don't need to give her any insulin today. So that leads into the next discussion about this. I want to do a second test, though. Can I just grab another strip and use the same little blood that she's got and see just like a second opinion? I don't know why we couldn't do that. There's still a drop of blood on your ear. Is there? Come here. Come here. I want a second opinion. So this is one of the reasons that we had talked about doing it this way, is that apparently for cats it's not entirely unusual for diabetes like this to go into remission. And that's... I lost the blood though, so now I'd have to poke her again, and I'm not going to go that far, am I? I'm not. I'm not going to do it again. We're just going to go with the results of that first one, which was, by the way, 102, which is perfect. I mean, really healthy, perfect. So I'm glad we checked. I know. Well, you don't have to do the insulin today, though, and I'm going to give you another treat. I know, and we'll check again later today, too, just to sort of start to get an idea. Okay, I'll put one in your food so you go back to eating. There we go. Okay, so what was I saying? I was going to say that that's one of the reasons we wanted to check, is that the vet sounded like, even though we'd sort of been down this road once already, the vet made it, I keep saying the vet, it's Dr. Katz made it sound like having it go into remission is not out of the question still, and that we should be checking it to sort of see. So there you have it. And she said anything under 200 would be something where I wouldn't want to give her the insulin for the day, but we should keep monitoring it. Now 100 is actually like a perfectly healthy number where you wouldn't even think she has diabetes. And like I said, and like the vet kept telling me, it is not unusual for a cat, at least, that has been treated with insulin for a few weeks or a month or so, or a few months as in this case, to go into a remission. So that's really, really great. And I don't know how long you expect those remissions to last, if you just expect her to be fine now for the rest of her life, or if you expect that she might, sort of start to develop some blood sugar symptoms again down the road. I'll have to talk to the vet about that and do some research online. But it seems like really good news if that test is good today, that her blood sugar's at about 100. I think it was actually 102 on the little meter there, so that's really good news. Maybe we can end up getting her adopted out as a cat that doesn't even have diabetes, and that might help her chances quite a bit. We'll see. So I'm glad we checked. And I'm glad that I had that chat with the vet yesterday while we were there. And I should talk to all of you guys about what went on at the vet yesterday, too. Because we weren't there, obviously, for Brooke. We were there for Belle and Belle's kittens and getting Belle's x-ray and stuff, which we did. So why don't we go see her, and I will talk to you about her while we are in there. But first I got to get some of this stuff put away, all right? Uh-oh, what did I do with those used test strips? Did I get them? I guess I got them wrapped up in this napkin, didn't I? Okay, I'm going to assume I did. Get so easily distracted and confused. Distracted and confused. That's how I work. Okay. Let's put your temptations away, too. Sorry. Good. Hey, that's actually really good news, right? Like, I'm so distracted by what's going on here right now that I guess I'm not making as big a deal about that as I oughta. But that seems like a really big deal that she had a good test here first thing in the morning. Of course, I don't know what all the factors are. Like, she's been in here eating for a few minutes. I don't know what difference that makes. And also, I should just mention that the vet told me that, if you're giving a cat insulin all the time, it can sometimes throw those numbers off itself. She said there's a name for it. I can't remember. It starts with an S. But she gave me some urine tests, too, that she said would give me, like a more accurate reading over time, that it would give me a better idea, if if we are or aren't throwing it off by the use of the insulin, in the moment, I guess. If I'm putting that right, I hope I am. So hang on, let me put this insulin away. I guess my whole point is that I don't think one test is, enough for us to be like, oh, hey, everything's great, we're done, she's fine forever. I think we're going to need some more tests and some confirmation about all this. But I think that's really cool, and it's a good sign, isn't it? I think it's a great sign. Now, I've still got some of her blood on my fingers, so I'm actually going to use this hand wash station for a second. And there are no cats for you to see, unless you can still see Acro all the way down there at the end of the hall. Can you see him? I don't know. Give me 1 second. Speaking of blood on my hands, I was talking yesterday about how I couldn't lance myself. I couldn't bring myself to do it, even though I get bitten all the time and I get scratched all the time, and I'm used to getting puncture wounds and bleeding, and it's fine. And yesterday, I guess that Pebble was listening because I was feeding her some chicken as a treat from my dinner plate, just a tiny, tiny piece of chicken, and Pebble gets so excited for her treats, especially when it's people food. She just got really, really, really excited, and she chomped down as hard as she could, but she missed the chicken. She got my finger. She's got those little tiny kitten needle teeth, and it gave me a pretty good puncture wound there. So yeah, she must have heard me talking about how I can't lance myself, and she was like, I'm gonna help. So, and she did. Yeah. But that's what happens. So anyway, here's our Belle. And so now I was going to talk to all of you about what went on with Belle at the vet yesterday, and it's all good news. We had her blood tested. I don't think we have the results of the blood test yet, but we just did it to get a baseline. The vet wasn't even really going to do it, and I was like, no, let's just do it while we're here, and that way we've got some numbers and we can decide if there's anything that's way out of line. So that was good. We also dropped off a stool sample that we don't have the results of yet, but I think it's also going to be fine. No reason to expect that there's any issues there. However, we did also get her x-ray, and we also, the vet found a single flea. We've had obviously a lot of cats that have had fleas, and normally, it's like an infestation when they come in and we're like, oh, there's fleas everywhere, let's take care of this. But for her, I didn't notice. She must have only had like 1 or 2 that she brought with her. Maybe they'd already sort of treated her for it. I have no idea. But to make sure that we nipped that in the bud, we gave her some Revolution, which the original Revolution, which is fine for pregnant cats, it's been tested. Not Revolution Plus, which is also probably fine for pregnant cats, but hasn't been tested. And then just to make sure that those fleas had no quarter, we also gave Revolution to everybody else in the house, the kittens included, yesterday. That way those fleas have nowhere to go. So that's the plan. Then the x-ray, of course, the thing that everybody wants to hear about. The x-ray was a little bit difficult to read. We only did the one, but it clearly showed two kittens. So we know that there's at least two in there. And, the more I look, the more I suspect that I see at least three. And there could even be four or five, like the ultrasound person thought. Of course, ultrasounds are notoriously difficult to tell, get an accurate count of kittens with. So, the fact that the ultrasound person could have been wrong is not unusual. It's very expected. But right now, our over/under for kittens is probably three. There could be five. Jay Serenity says, I thought I saw five. Hey, maybe you did. All I know is that we definitely saw two, and then maybe more. Now, we've scheduled to bring her back for a second x-ray next week so that we can get an update on the progress and maybe a different view. They move around in there. And so next Tuesday is when Pebble is going to go for her graduation surgery. And when we pick her up from that, we're going to bring Belle here back in and get a second x-ray and see what we think. Now, because we can see kittens on the x-ray, the kittens start to appear on the x-ray somewhere between 38 and 42 days of pregnancy. That's when they start to appear. So we know that she's basically been longer than 38 days, right? We don't know how much longer necessarily. She could be ready to deliver tomorrow, or she could be, several weeks away. The overall length of pregnancy for a cat is like 60 to 65 days, give or take a bit. So we're looking at basically anywhere from tomorrow to 20, 25 days at the outside, if it's a late delivery. And we don't really know where on that spectrum she is, although I think from the way that she seems so calm and you don't feel any little kittens kicking and she just doesn't seem all that swollen yet, we're probably on the low end. I think we're probably closer to 20 days left than 2 days left. I don't know how much closer. It could be a week. I'd buy that. I'd buy 2 weeks. I think it's starting to sound real realistic. So I think 2 weeks sounds about right to me. Of course, I'm not really going on much there. I'm just sort of guessing. Now, I also want to mention for people that are watching the stream really carefully, you probably noticed that she didn't eat a whole lot of her food last night or yesterday. We gave her, I think, a total of 4 cans of food every day usually, and she usually finishes it by the next morning. Yesterday she didn't, and it could be because the vet trip stressed her out, or it could be because there were some probiotics in her food and we haven't been doing that. Yesterday was the first time, so maybe she doesn't like those. So today I've given her the usual food without probiotics, and I've also given her some RC mother and baby cat again in case she wants to just try something different. I know the vet would definitely prefer that we stick to stuff that's high protein, low carb, which the RC mom and baby cat is not, at least not compared to the Fancy Feast. But in my opinion, it's more important that she eat anything at all, right? She's got to eat something. So I'm going to give her both, and we'll see how it works out again today. But now the whole time that she's been here, she never eats in the morning. She always waits until evening, and then she usually eats most of her food overnight. So she hasn't dug into the food I gave her this morning yet, but that's not unusual. I'm going to start taking her weight too, make sure that she's keeping her weight up, and we'll have to see if we have to take any sort of extra special plans about that. I do see Jay Serenity saying maybe she's a dry food cat. Yeah, I had that thought too. We really don't want her on the dry food. But if she continues to not eat anything that we put in front of her for more than another day, yeah, I'll give her dry food. Again, it's more important to me that she eats something than that she eat what we want, right? I mean, I didn't phrase that right, but you know what I meant. We want her to eat something. So we'll try that when we start to get desperate, but we're not desperate yet. My guess is that she was just put off a little bit yesterday by either the vet trip or the probiotics or both, and that today she's going to eat perfectly normally. But if she doesn't, then we'll take the next step. Donna, is dry food not that great for cats? You know what? I don't think it's terrible at all. It's definitely, one way to feed your cats. But the trick is that almost all of the dry foods that you can find are going to be a lot more carbohydrates than you would want. Normally what you want is very low carb, very high protein for a cat. And dry foods are very rarely that. So I've read that some of the really expensive ones claim to be low carb, but most of the ones that I see don't actually claim to be low carb. A lot of them claim to be low grain or grain free, but I've mentioned it before that grain free does not mean carb free. In fact, a lot of the grain free foods have things that are high carb, like I see sweet potatoes all the time in them, or carrots, or regular potatoes, or all kinds of things that are just carbohydrates, but not grains. So they can say, oh, our food is grain free. And people are like, oh, it's grain free. That's good. And you're like, well, yeah, but it's full of carbohydrates. So dry foods, it's hard to find one that would be actually low carb, high protein. And that's why we try to avoid them. All right. Well, hey, look, guys, it's been 22 minutes and we didn't make it to the kittens yet. I know you guys want to see the kittens. How about if we just run down there and we'll just end the stream looking at the kittens, okay? Because I know I keep going over. We had a lot of extra stuff to get to this morning, a lot of extra stuff to talk about. And so let's go down and see those kittens. Let's do it real quick. We got to wrap this up. Speaking of seeing the kittens and wrapping it up, Brooke, you want to come out for a little bit more? Do you? You want to come out? You can come out here. Just for a few. I'm going to leave your door open. Okay. Just going to leave it open for a few. All right, let's see the kittens. Sorry, folks. And I know some of you are like, you tune in for the kittens, and I made you wait 21 minutes, 22 minutes today before we had any kittens. I'm sorry about that. So here's Kulat, very happy. And there is Pebble over there. And it seems like her usual place, the same place we found them yesterday, isn't it? We found Kulat up in the tree and Pebble sitting over here in her little hammock. I guess that's how they like it. Let's see if you can hear Kulat's purr. Now, they hung out with us again last night. I think if you were watching, you saw. But I'll tell you, my favorite thing that happened last night is after we opened all the doors to let them out, they both kept coming back in here to play with each other and with the faculty. And there was a lot of that you could have watched on the regular Kitten Academy live stream. And I thought it was fantastic. And in fact, Kulat and Custard did a lot of playing and fighting in here on the regular Kitten Academy live stream. And it was really fun for me to watch. That was last night after we had the doors open and they were free to go anywhere in the house, and they still kept running in here and wrestling, and it was very cool. So I expect some more of that. Although maybe tonight, I'm going to talk to DJ. DJ's not here tomorrow night. She is here tonight. So maybe tonight I'm going to try to get Brooke in the spa, or if DJ would rather have kittens on the night she's here, then I'll do it tomorrow night when she's not. And that means the kittens will be in the room. We'll see about that, though. So, yeah, there you go. All right. Well, hey, look, this has gone on plenty long enough. If you want to keep watching these kittens, just look for the regular Kitten Academy live stream right here on YouTube. Thank you guys all so much for listening to me ramble on and try to deal with our mom cats this morning. I really appreciate having you all here for me first thing in the morning, and for the cats, of course, too. But it means a lot to me, especially before I've had multiple coffees, to have all of you here as my friends. And I really do appreciate it. And I will do it again tomorrow, and we will try to keep it just a little bit shorter. Thanks, folks.